Good morning. My name is John Porter. I'm the Medical Director of Physical Medicine Rehabilitation at Valley Wise Medical Center. My talk is going to be on integrative medicine blending in traditional medicine. The physician of physicians, Hippocrates, said we have but one single task, is to cure, at least help. And if it succeeds, it matters not with what we means we succeeded. So in other words, my talk is talking about something that may not be within your studies or your knowledge base, but this is the integrative or ancient medicine that we're starting now to integrate back into traditional medicine that we know. So my background is a physiatrist, and that is a specialty of physical medicine and rehabilitation, which was established in 1949 as American Board of PM&R. It was popularized after World War II when the soldiers came back that were traumatized and they didn't know what to do with the head injury, spinal cord injury, amputees, etc. So they started saying, well, we need to rehabilitate these people and we need to have a separate division of physicians that deal with it. Simultaneously, something similar, analogous of OBGYN, they had physical medicine. And physical medicine was a division under radiology, which is a treatment, not diagnosis of issues. So they blended those into this field. It was popularized also with the polio epidemic and FDR. So that then became a board specialty by 1950. My interest is in trauma, but the non-surgical approach. So I'm the only non-surgeon in the surgery department of Valley Wise and have been there for greater than 35 years. I did my residency fellowship in spinal cord injury and neural rehab from 1981 to 86. I finished and signed up with Valley Wise and have been there since. I'm in the Department of Surgery, subdivision of trauma and burns. Next. So as you can see, the history of medicine is thousands of years old. What we're used to in our allopathic division is about 250 years. So a lot has changed during that 250 years, and we have advanced and continue to advance as the knowledge base doubles within every few days, if you will. Allopathic medicine really started by serendipity, if you will, because the initial physicians were actually homeopaths in the United States coming over from the Mayflower. And so as things moved on, we then by serendipity developed all these things. But as you can see on this slide here is on the far right, you can see that's the Chinese, they call it 5 elements or co-cycle. And you can see that what happened in Western medicine on the far left, they divided this into the 4 humors, being yellow bile, black bile, earth, phlegm, and blood. And so by this principle, the Chinese used bloodletting techniques by functioning needles. And what they put the needles in these acupuncture points to move the life energy, or what they call qi, in the meridians, which I'll talk a bit later. That along is a modality, so it would be a temporary solution. So they would use Chinese herbs, massage, such as Tuina, diet, therapeutic, mind-body exercises through Qigong. Now on the far left, you see a barber's pole. And the barber's pole has its origin from the barbers, which barbero means beard. And so in the old days, they would cut the beard to cut the evil spirits and allow your energy to improve. So the barbers then became the early surgeons. And so as you can see, red, white, and blue on there, red means bloodletting, venous, and white is wound care. So as you look over to the right, you'll see where they would drain the blood into a piece of supporting material that would supposedly cleanse the blood. And on the top of the pole were the leeches. Next. So this here shows that over in the right corner, they actually had psychiatrists that the bloodlet to improve the psychiatric component. Now, the next slide down there here shows within a 10-hour period, almost 4 liters of blood was withdrawn from the president of the United States, the first one, George Washington, back in 1799. And they were trying to treat an inflammatory disease called quinsy, or sore throat. And apparently there's controversy whether this actually resulted in his ultimate death. Irregardless, 4 liters in 10 hours is quite a lot of blood and was not effective for treating sore throat. Now, if you look at medicine in the United States, it was developed by serendipity. If you look at Ignaz Semmelweis, who was an obstetrician who promoted hand washing in 1844, which what happened, he was a obstetric gynecologist, and he found that some of the people that did the autopsy would then go directly and deliver babies, and there was high incidence of infection. So he promoted hand washing, but of course that was not accepted. And if you read his history, you'll see where he actually ended up in a psychiatric institute and ironically died of sepsis of a wound in his hand. Robert Koch in 1871 had colonies on potato slices, and he left, I believe it was Easter holiday, came back and found that these bacteria were thriving on this, thus the start of agar. William Röntgen stumbled on a cathode, and he then labeled the ray that came through an X-ray. In 1895, he took a picture of his wife's hand, and then 5 years later won the Nobel Prize. That's the start of radiology and interventional radiology as we know today. And then Alexander Fleming, who discovered penicillin in 1928, a similar thing. He went back, came back from Easter vacation and found one of the petri dishes did not have any growth where the other one did, and thus development of penicillin. And lastly, I thought Barry Marshall was interesting in 1982 with Anna era. He was telling that the gastric lining had slow growth bacteria called H. pylori. The medical community did not accept that. And so he himself infected himself and treated with antibiotic, and thus introduced how we treat H. pylori today. So we've come a long way in medicine from those days. And to discuss pain, pain really is not a sensory, but it's an emotional experience. And it's really associated with perception rather than a sensation. And you probably have seen that in the prior lectures. And the word pain comes to the Latin word pena, or punishment. And so the people in the old days thought that pain was induced because of some punishment type of thing that they experienced. So in the Old West, we said, yes, Clem, it hurts, but you know, it's a kind of a good hurt. So what are some of the techniques we use? Mind-body therapy, which is relaxation, meditation, imagery, cognitive behavioral, yoga, etc. Biological-based principles, which I won't really talk about, are nutrition, but in supplements. For instance, homeopathically, they have arnica, which were promoted by the curanderos in Mexico, which helps with musculoskeletal pain. We also have CBD, which hopefully we can advance it from a class 1 drug and we can study it, because if you know, you've learned that there is opioid type of treatments, which are one set of type of areas that control pain. Then you have NMDA antagonists, and then you have endocannabinoids, which follows the CBD lining. You have manual therapy, massage, reflexology, acupuncture, and acupressure, which I will talk about. Energy medicine, which is Tai Chi, Qigong, Reiki, therapeutic touch, aromatherapy, spirituality. I won't talk about nor placebo, but I can tell you that we have the second leading burn center in the United States. And I sit next to the chaplain every week in burn rounds. And we do address spirituality, and is a very important thing in the overall spectrum of trying to treat somebody in a multidisciplinary approach. So I had the good fortune of studying a little bit in Harvard with a fellow that you'll see in a couple slides from here. But the theory is that most of the disease are from a genetic, epigenetic, environmental, mind-body effect on proteins, lipid, and metabolites. And so you can see this whole spectrum of genetics to environment and having all these different components that affect us, including diet and drugs. So the overall integrative medicine, if you will, has to do with Ayurvedic, Chinese medicine, Native American medicine, light, sound, augmentative therapies. And I'll talk about some of these briefly, but since there's such a crunch for time, this is just simply an overview. So now we've seen some of the TV physicians now embracing Eastern medicine and integrating that so that the public can see that there is value in doing so. I can see where Western medical science and Eastern tradition of wisdom eventually will be the future of nanotechnology. I did study in China before the SARS-1 epidemic, and they see the West Wing and East Wing. There were two different sets of the same hospital carrying on this blended type of medicine. It was quite effective, and that was in the late 80s, early 90s. Okay. This is Herb Benson. Herb Benson is a physician who also had influence on me to think out of the box. He is a professor at Harvard. He's in charge of the Benson Henry Institute for Mind-Body Medicine at Mass General Hospital. He popularized the book, The Relaxation Response, and on the left is when I had some time to spend with him, and he was telling me as a young man back in '68, he was a cardiologist looking at alternative options other than medication to control hypertension. And these slides will show that he was really working in the pink area of placebo, relaxation response, PM&R, biofeedback, and these folks with transcendental meditation kept bothering him and said, we need to have you include this in your study. So after probably 6 months, I believe is what he told me, he finally included that and found that it was far superior than anything that he had tried to do related to hypertension. So that promotes the book, The Relaxation Response, which was a national bestseller at the time. So what are we trying to do? Quality of life, we define it as physical, psychological, social, spiritual, just a sense of well-being. And so when we try to heal, is trying to find out what that person perceives as what they want to achieve on a physical, spiritual connection or whatever you like. But it's so important to respect what that person's belief is in their capacity to heal, because if you will, if you go into ICU, that's all biofeedback. It's hooked up to heart rate, blood pressure, temperature, and it's giving you feedback of what the body is responding to what we're trying to do through a critical approach. So here on the left is just showing how simple things used to be. Thank you for your consult. You either have the plague or don't have the plague. Well, now you can see it's far more superior. I mean, so complex. And you have old and young trying to deal with this whole spectrum. And then you start having COVID put in there and other factors that are just stressing a system, because some of these things are known and unknown, and we just have to learn by the seat of our pants sometimes and just accept what we see and try to deal with the tools that we have. So this slide comes from, again, my time with Dr. Benson, and he has a whole division which looks at mind-body impact on epigenome, RNA, all the way down to phenome, which is stress, disease, and inflammation. And the next slide will show you that this is out of PLOS 1, that mind-body practice actually is key to turn genes on and off, and you can affect your physiologic state by what you think and what you do. This is a picture of the homunculus and the signals coming from the neospinal thalamic and the paleothalamic cortex. And if you will, on the right, you can see where it comes up into the thalamus there and is discerned in the thalamus as to where to direct it. And it goes to the various parts of the homunculus in motor and sensory fashion. If the signal is chronic, more than 3 months consistent or so, the body then sees the same signal over and over. And if it's an alert signal, it sometimes can be diverted over to the homunculus, but most of the time it's then seeded and sent to the limbic system and discerned in the paleocortex and the bilateral frontal polar cortex. So when we talk about our current level of functionality mentally, we have a conscious and a subconscious component. The subconscious is when we sleep. We're not thinking about our physiologic makeup and how things are going, your heart rate, your breathing, your digestive tract, and you're in a state of healing, if you will. And so when you go into REM sleep, you're actually secreting growth factor and things to heal your body. When you get to the conscious state, all the things that are maybe subconscious, conscious become visible, but it's only 10% of the game. So when we talk about cognitive behavioral therapy, we've shown imaging studies conducted before and after treatment for like post-traumatic stress or pain. And there's activation of this prefrontal cortex that we talked about. There's also involvement in the hippocampus and normalization through affecting the amygdala to stress. Now, I don't know if the physicians before gave a talk, but when you use opioids, which affect the mu receptors, it can eventually cause hypogonadism. In other words, testosterone deficiency and estrogen deficiency by the use of that medication. So all these factors, whether it's intrinsic or extrinsic, drugs, other, affect the brain and the function of the brain, be it through neuroendocrine or other. So cognitive behavioral therapy focus on thoughts, emotion, behavior, and physical sensations. They take all that, whether it's addiction, pain, and they try to then have you learn these things of problem-focused, emotion-focused thoughts. So basically, you're learning how to control these things physiologically by using your mind, by learned behavior. This is a more complex slide, but on the left, you can see where there's psychological treatment, psychosocial function, and brain systems or psychological functions, and the different parts of the brain that have effect by different types of things. So biofeedback would be in the hypothalamus. The frontal cortex would be mindfulness or cognitive remediation. Yoga is more of sensory motor integration through etc. So when you look at chronic pain, you're looking at a cycle, a vicious cycle. As the pain increases, so does anxiety, because they're all driven by the same pathways. And then you have sleeping problems, coping problems, and then it manifests in the picture above where you start getting to different parts of the sphere and then becoming stuck, if you will. And the only way to get out of it is not with medication or surgery, which are just temporary agents, is actually addressing the emotional component that drives us to believe we have pain. So this is an example of one slide that I thought was fascinating. The first one talks about nociceptive pain. So as you can see with nociceptive pain, you have noxious peripheral stimulus with heat, cold, and that would give a withdrawal reaction or a mechanical force or chemical irritants. B, which is inflammatory pain, is the noxious stimulus that causes from tissue damage through the inflammatory soup that you've learned, or peripheral stimulation or sensitization, and causes a spontaneous pain or pain hypersensitivity with reduced threshold. In other words, when you touch your hand, you would feel pain when it should be perceptive as just light touch or pain. And the increased response is hyperalgesia. So it's important to look that there is spontaneous pain created from B all the way down to D. Now, neuropathic pain is when you actually have a severance or an injury to the peripheral nerve, be it a gunshot wound or even neuropathy of diabetes, where there's injury to the nerve. And so you have spontaneous pain and pain that's hypersensitive. If you look at D, that's functional pain. In other words, people that have behavioral health issues believe they have pain, yet they have a normal peripheral and normal tissue, but yet they create spontaneous pain and pain hypersensitivity. So this should show you that it's really a perception, not only of injury, because on peripheral nerves, you'll have emphatic codes that send signals of abnormal signals to the brain saying there's something wrong, but indeed there's nothing wrong, but it has the same net result. So biofeedback is just a means of using some of the mechanical things that we have or instrumentation that we have to create a learning of psychosomatic self-regulation. In other words, you have people that learned how to sleep on a bed of nails, walk on fire, but that was a trained mental control. This is a trained mental control by instrumentation. So it creates a cognitive somatic process, and you have self-regulation and control, which is very similar to early type of applications that Dr. Benson was using until he found out that there's other things that you can do that are far more superior, but these instruments act as adjuncts to achieve those processes. So this is a picture of the homunculus, if you will. And when you have an amputation of a limb, you have a somatosensory homunculus deficit. So the brain is sending you a signal that there's something extremely wrong with the area that's been amputated. And so that's why they call it phantom phenomena or phantom pain and sensation. To treat that, we don't really use medications like in the burn unit. We try to use cognitive remediation. So here is an old mirror therapy. And Dr. Ramakshan out of San Diego, which I'll mention him a little later, next slide. But he's the one who actually looked at this and saw that you can show there's a change in the limb that's amputated and convince the brain that they're seeing a normal limb. And what happens in the amputated limb is it'll telescope. In other words, it'll become smaller and absorb into the residual limb. And if you read his books, they're absolutely fascinating because he has gone into the science of how the cognitive effect has affected how we perceive pain. Could we go back to the previous one before this? So you can see now we've gone from the mirror therapy to virtual reality. So in the burn unit, as we're giving people treatment with wound care and such, we are lessening the medication we use by using virtual reality. And the slide on the right shows no virtual reality. You light up different parts of the brain that we talked about, the yellow meaning high intensity and the orange and green being less. But you see with virtual reality, you actually diminish some of those in the somatosensory cortex and in the prefrontal region. So you eliminate pain using this. You can do it through virtual reality. You can do it through biofeedback. You can do hypnotherapy. Medications, all these things actually work similar on different pathways. So the next one is hypnotherapy. So remember the slide I showed you that 10% is conscious mind and the subconscious represents 90%. So long-term memory is in the subconscious, where short-term memory is in the conscious. Emotional feelings, habits, creativity, developmental stages, spiritual connection, intuition are all in this subconscious mind that we try to tap in to affect the conscious mind. So we can do it through hypnotherapy. And basically that's a state of human consciousness that's involved with focused attention and suggestion. And there's 3 types of hypnosis. It can be absorption, dissociation, and suggestibility. All that's explained, but what you're trying to do is alter the behavior and change future actions. So you can see up there that these brain scans show that you can actually change how you perceive pain, how you perceive emotion by your thought. So as this is a fellow that I have in a picture in my room that I hold a high regard. We cannot solve our problems with the same thinking we used to when we created them. And you always get what you got. So the separation between past, present, and future is only an illusion, although a convincing one. Here's the practices of Qigong, Tai Chi. All these are various types of exercises that really affect these meridians and acupuncture points that I will talk with later in the here. But all you can see that each one of these areas on the yoga are stimulating different parts of the meridian cycle. So physically, you can heal yourself through that means of electromagnetic suggestion, or you can use the ones on the left, which are then Qigong or Tai Chi. They all stimulate acupuncture meridians. It's through dynamic and static stretching, but it's evidence-based approach to improve health related to quality of life and effective for physical conditions. I practice Qigong almost every day, and it helps with some of the stress and anxiety. And it does help me sleep. It helps my physical state, also helps pain that I have. Once you get to 70 years old like me, you start realizing that you have a lot of discomfort that all has to do with need for something. And when you're told you can't take anti-inflammatories at your age because the Beer criteria says no, you have to look at some other options to control pain. So this is my dog Fifford. God bless him. He is an animal that he would sleep on my clothes and surround himself with toys to obtain nirvana or lessen his stress at the postal worker. This is light and sound machine, very similar to biofeedback, but these are different light and sounds that are binaural beats and LED lights that stimulate your brain to go into theta, beta, delta, and alpha states. Instead of trying to meditate to achieve those, as like the fellow on the left, you can do that and like walk on coals, etc., or you can use this instrumentation to stimulate that so you don't have to spend hours to learn how to do it, and these will allow you to get in these states. So what I'm trying to say, that instrumentation can help you achieve eventually using and training your own body to be able to do and achieve those states. So acupuncture is something that's very dear to me because I am board certified in national, international acupuncture. I went to Beijing prior to the first SARS epidemic and was very humbled by just what goes on. So you have, it's been around since 100 BC. So we're talking about 300 years old. They're 100 BC. So way advanced before us, without the technology that we have today. And you can see it's body, auricular, scalp, hand and foot, acupressure, electroacupressure, laser acupressure, meridian regulating, and radaraku. So, and today, if you look on the left, we look at body systems through energetics, through aerobic glycolysis, anaerobic phosphagens, etc. The one on the right shows pictures of meridians and acupuncture points. And the center ones are what they call chakra, which are really neuroendocrine junctions, and they all flow together in a fashion. So this slide shows you that in the right lower quadrant is the traditional acupuncture points. This fellow behind me has been with me all these years. And there are 365 active points. So if you look at acupuncture, it is present with us in time and space. There are 12 paired meridians called yin and yang, but also it's also interesting that we have 12 hours AM and 12 hours PM, and each one of these are synchronized to time and space. So every 3 hours, the paired organs change and the energies are high and low at that time. Also, with that, the initial one that I showed you about the 5 elements, every 3 months, there's a change of system within it physiologically. So it is really hooked up at time and space. Now, the one in the left upper quadrant is the ear. And if you look at it, is the exact homunculus that we know on the previous studies. If you stick needles in those areas, it corresponds to areas of endoderm, ectoderm, and mesoderm that we had in the embryonic state. And it also, if you see the hand up there, it's large, and it corresponds exactly as a homunculus. So the reason why I like to do auricular acupuncture is because it's like a remote control. I don't have to get up and change the channels on the TV. I can use my remote control to achieve the same code, if you will. So the acupuncture points are almost like the alphabet, and you form the alphabet certain words to get a certain point across, and the body can actually achieve that through the different binary codes that you then profess or teach it to do. So now the therapists are doing what we call dry needling, and it's done by our physical therapist. I just signed off on the paperwork the other day, and it helps with mainly musculoskeletal pain, neuromuscular pain, and movement. But acupuncture is different because that is far more complex. So this is like a grade school on dry needling, and acupuncture is like graduate school as far as energetics. You can use electricity in different forms to be able to achieve that. Through the needles directly to these acupuncture points, or to actually, next slide, to different types of myotomes or sclerotomes. So we have dermatomes, which are from the nerve, sclerotome, which is from the bone, ligaments, and myotome from the muscle. So they have different patterns. They look very similar, but they have different approaches to what the body is trying to tell you what's wrong. Here happens to be trigger points that happen to be upper trapezius that gives you the sign of a headache. So many times I see these patients, they go, well, the neurologist says they don't have migraine headaches, but they may have some other type of what we call cephalgias due to myofascial pain. These are some other examples. Going on the left, as we just introduced, and this is in the sternocleidomastoid, and the other one on the right quadrant is infraspinatus, and it shows you the different patterns that it shows from a pain perspective. This one here shows a patient, two patients. The one on the right is a gastroenterologist who is using all these muscles to do endoscope and ERCP, and the one on the left is a pulmonologist who is using a bronchoscope. So mechanically you can stress these muscles and they cause different types of pattern of pain. So the one on the left was mainly trapezius, if you will, and then deltoid, teres minor, and latissimus dorsi. Where on the right, it was more structure of rhomboids, levator scapula, supraspinatus, infraspinatus, and those various muscles that turned into these type of patterns, all treated with not with medication, not with Flexeril or things like that, actually with dry needling and stretching. This one is a nurse who, a nurse husband who snored. So the wife said, turn onto your left side, and he came to me with severe pain, which could be easily treated with just electrical stimulation. Here is all the different types of points. They have different type of patterns. If you know this, myofascial pain, Janet Travell wrote the book of myofascial trigger points. It's 2 volumes. I had the pleasure of meeting her. She used to be the President Kennedy's personal physician, who would use these different combinations of musculoskeletal and acupuncture points to allow him to be a president with severe back trauma and pain. Now we're going into the electromagnetic field, if you will. If you look on the right, there's X-rays, gamma rays, UV light, which we now are using UV light to kill the bacteria, such in our surgical suites in the burn unit. To clean them, we use that because that's where you have actually disruption of the bacteria and virus DNA. And then you have that thin light, which is visible spectrum, infrared, microwave, all the way to AM/FM radio. So this takes and looks at the high energy on the left, low energy on the right, and the high energy is the disruptive force, and it shows you the wavelength in millimeters. Here is now showing the part that I wanted to show you, because now you have nanometers that tell you how you can use those particular things for treatment. And if you look at infrared on the right, you have low light intensity and high light intensity, which is what some of the basketball players are using with far infrared or near infrared light to heal them, to speed up their treatment. So talking about this slide here, this is where laser comes in. So you have 2 types of light sources. You have laser diodes and LED light emitting diodes. Usual infrared is VR and infrared is IR. So visible red light is VR and infrared is IR. Most of these diodes emit between 600 to 900 nanometers in wavelength. So laser is the acronym for light amplification via stimulation emission of radiation, meaning the photons are amplified by the physical process of laser design. And then there's the low level, which is the low level therapy. They are monochromatic, thus emitting a single color light. And these emit a very narrow wavelength of 30 nanometers. Okay, so ultrasound is another means. It's a high frequency imposed onto a crystal, which then creates a piezoelectric effect. This changes it transforms into a mechanical injury from electrical to a mechanical injury, and this then changes and transforms into a vibratory sound wave known as ultrasound. So you can use it for joint improvement, pain relief. These are the different types of continuous modes, pulse mode, 3 megahertz, 1 megahertz output. The pros and cons is few diagnostic benefits. Well, that's true, but we also use the ultrasound to pulse medication transdermally that works effectively. And, whether it's a placebo effect, I don't care as long as it gets the outcome. You do not want to use ultrasound in someone who has, say, a prosthetic or metal, because the sound will heat that tissue as you do that. The next one and the last area is looking at TENS electrodes. You can see some of these are placed on myofascial areas, and some are placed on acupuncture points. Whatever you want to do, we try to use this as a temporary agent to control pain. You can have electrical stimulation that were produced in the old days in the Greek time with eels, where the Greeks put their foot in a bath, have the electric eel shock them. Now we've evolved into neuromuscular stimulators, electrical muscle stimulators, functional electrical stimulation that we use to help people relearn how to use function, say after a stroke. So it's almost biofeedback using electricity. Transelectrical nerve stimulation, which I'll talk to you about the father of that, and using iontophoresis, pulses electricity through topical medication that drives it into a system, say a tendon or a muscle, to control pain. So this man affected me more than anyone I can tell. He is C. Norman Shealy. He is a pioneer. He is considered the father of holistic medicine, if you will. And he started in 1978. He actually was a neurosurgeon trained out of Harvard who invented TENS, the spinal cord stimulator, and many other things. And he said, there's much more to life, John, than just what we know as allopathic physicians. And that's what made me stimulate my knowledge to go into learning some of these alternative things through rehabilitation. So I went to him at the Shealy Institute for Pain in Springfield, Missouri. And then I saw where Shealy pain and rehabilitation kind of meshed with what I was thinking. And I have lived my life dealing with this particular thing. And now my time is at end after 50 years of medicine, but I still wear a bolo tie, as I can show you, as he did, because he influenced me. And by the way, for all of you who don't know, bolo tie is the official tie of Arizona. So with that, I appreciate the opportunity of talking to you. I'm sorry that it was a lot of information. I may have left out some things, but it was just a gross overview of some of these other options that we can use for pain that may not be mainstream to what you know, but they're out there. And if you look, there's many, many other things that we can use that I use every day traditionally here. Thank you very much for the opportunity to talk to you. Thank you.